So I get asked a lot of questions about interviews, and one of the most popular questions I get asked is about its format. And that's because I think people tend to associate the format of the interview to the types of questions they'll be asked and how that will affect their ability to do well, and therefore how they should be really preparing for it in different ways according to the different challenges that are thrown at them. So I want to clear that up so that you get a better understanding of what the formats really involve, how they provide different challenges, and what the real difference is at the end of the day when it comes to preparing for interviews that are of what I call a traditional semi-structured format or a more modern multi-minute interview, otherwise called MMI format. So what you can see here is really the comparison side by side. So what we have in front of us is a table that talks about the two different types of interview formats. So I want to take a little bit of time to run through each and explain the differences and the similarities too. So you can see on the left hand side there is what we call a traditional interview format, and in other words people call that a semi-structured format. On the right hand side we have a more modern multiple mini interview format, or otherwise known as fully structured. So one thing I want to really quickly point out is that both of these interviews are structured in some way, one semi, one fully. So where is the structured part of the interview talking about? What is it talking about? It's actually talking about the marking scheme. Because at the end of the day, for doctors who work across different environments, different clinics, different hospitals, you can imagine the type of interactions, the type of challenges, and the type of obstacles they need to overcome every day is similar. Right, imagine a GP working in one suburb versus another suburb. Of course, there'll be variations in the specific types of patients that you get and the cases that you get, but you still have to be empathetic in that particular way. You have to be, good at problem solving for those particular cases. You have to be good at being compassionate, non-judgmental, have leadership skills, so on and so forth. So what I'm trying to say is that at this preliminary screening for medical school entrance, the core traits are the same for most of the medical schools looking for candidates. It's meaning that everyone's looking for the same great traits that would help them determine you as a very, very suitable candidate. Of course, there may be universities who add on additional unique traits because these universities have maybe additional focuses, such as a strong focus on rural health or indigenous health. But besides that, I would say 95%, or thereof, the traits are exactly the same, for medical schools, right, throughout the board. And that's why you get the whole semi-structured and the fully structured, in that it's just a difference in format and how they interview, not even so much necessarily the questions they ask, but the mannerism in terms of how they conduct the interview to identify whether or not you have these same traits. Likewise, for dental interviews, again, a dentist, wherever they work, will have to share similar traits as well. So yes, they may be called the same traits as doctors, empathy, problem solving, but I can definitely tell you right now, for instance, with problem solving, the problems they'll be solving will be drastically different to that of doctors. Obviously, doctors have more of a focus across the body, whereas dentists are more focused on the oral area, the teeth primarily. So of course, it's a different procedure. But anyways, looking at the left-hand side for traditional interviews. So semi-structured, usually 20 to 30 minutes long, so not particularly long. And it's also always held in one location, as meaning when you enter into the interview, you conduct your entire 20 and 30 minutes in one room, in one place. You're often given a panel of 2 to 3 interviewers, whereby if one interviewer would be asking a question, the other two would be listening attentively. And they may jump in, and ask questions as well. But it's a very dynamic, interactive format. In terms of interviewers for semi-structured interviews, we typically understand them having more autonomy. So what do I mean by having more autonomy? It means that they can direct the interview questions they ask you however they like. So at the end of the day, it's kind of like thinking about an interviewer per interviewer having a mark scheme, right? Imagine, and for argument's sake, that each interviewer is looking for 10 core traits that they want in their desirable candidate. And each of the interviewers has a mark scheme for each of the 10. So if they were to ask you a question to start off with, let's say, why do you want to become a doctor? And through your response, you were able to demonstrate, let's say, 2 or 3 of these traits really, really well. For those who don't know what I'm talking about, it's probably a good idea to review the videos before this one to get a better idea of what interviewers look for. It means that out of the list of 10, they might have already given you a good mark with enough evidence to basically say that you're good at empathy, leadership, and teamwork. However, for the remaining 7 traits, you might not have talked about them yet. So the interviewer could completely shift the direction of the questioning to be about a topic that they feel would be easier for you to discuss these traits. Right? Remember, every single interview question is just an opportunity for you to respond to. So it's very much directed and targeted in that way. And sometimes if they know that maybe you need a more of a probing, situation whereby you've explained yourself but not to the degree they want you to, they'll give you like a second opportunity by asking questions like, oh, tell me more about that thing you talked about. Oh, what about that thing you talked about? So it might, instead of taking a completely different direction, they might want you to expand further and explore more depth. So interviewers in semi-structured interviews, I would say, are experienced in doing that. And they're, as a result, for the entire interview, they're just scanning for all these traits. And sometimes you might double up on traits, which is fine, but you really need to have a wide coverage, to make sure that you are the complete package when it comes to having all the traits that they desire. So they really direct it. And in one part, you can also argue the fact that how you answer questions is how they will direct the interview as well. So it's really dependent on the quality of your answers. And I've known students in the past who've gotten asked minimal questions. I had a student right now, let's think, 13 years ago, whose semi-structured interview was 10 minutes, whereas it was normally supposed to be for 30. And he was only asked one question in that particular interview. And the question was, what are your hobbies? And through the response, he was able to completely wow the interviewers on that particular day, and he received entry, despite having a very low, back in the days, UMAT score, and relatively low academic grade. Okay, so that's the kind of impact that you would have if you're able to know what the interviewers are truly looking for in being efficient in how you score. But the questions, generally speaking, are personal in nature. Sometimes they're called behavioral questions. So personal style questions are the ones that focus on opinions that you have about yourself. What are your hobbies? What are your weaknesses? What are your strengths? What is the biggest failure you can recall? What is your proudest moment in the last 18 months? Questions like that. Very much about who you are. The questions usually are shorter, in nature as well. So they don't tend to be very, very extensive in having a lot of complicated scenarios, things like that. However, we're not saying that it's excluded. In fact, I would say maybe 80%, 70-80% of the questions in semi-structured interviews are of the more personal style, but you do get occasional questions that are longer-winded. It really just depends on the university. And in fact, every year they kind of change up the questions as well. Well, they definitely change up the questions. But the main thing is that it's still primarily focused on you and directly about you as a person, right? Not about any external thing. That doesn't mean, just as a disclaimer, to not bother preparing for all other question types. We'll talk about that a little bit later. But at the end of the day, it's to see whether you're suitable, right? And that's how they assess you in determining whether you have these desirable traits. So MMIs, on the other hand, are much longer, 60 to 100 minutes. And the main reason for that is because it's not in one location. It's in several locations, and we call them stations. So the best way to think about this is if you have a very long hallway, you have 4 rooms on the left, 4 rooms on the right, and there's doors entering each of these rooms. And there are seats placed outside just next to the doors, next to the entrance of each of these rooms. So when you're looking at that, well, how is it then done? Well, for each of these rooms, there's one interviewer. And before you enter into the room, you're actually given usually on the clipboard, the actual question. And these questions are typically not the personal style questions. Although personal style questions can be asked later in the station once you enter into it, they're usually more of the longer, more detailed, scenario-based ethical questions, whereby you're given a scenario involving, let's say, a doctor and a patient, and then the patient did something and the doctor did something. Maybe the doctor responded in a way that was really poor, that offended the patient, that kind of scenario. So we're talking about usually around a paragraph worth of content that is asked of you, or ethical questions such as what are your thoughts on legalizing marijuana? Okay, what are your thoughts on active euthanasia? Things like that. So every station, when you sit down and wait before you get into the station, will provide you around maybe 1 or 2 minutes to read up, on the actual question on the clipboard, and you're given obviously the same amount of time to plan. So that's within the 1 and 2 minutes. Then a bell will literally ring, and then you'll be basically asked to enter into the room. You will greet the interviewer, and the interviewer will start asking you questions based off the scenario or the original question on the clipboard. So the idea here is that you then get around 8 to 10 minutes to respond. After you finish and answer all the questions that you're thrown at, the bell rings again, you exit the room, you move to the next station, further down the hallway, and then the cycle continues. So now you read another clipboard for 1 and 2 minutes. After that is done, you then enter into the room, 8 to 10 minutes, etc., 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 and you move around the 8 stations. Usually it's 8 stations, for the MMI interview. Sometimes there's a rest stations, sometimes there is not. So the idea here is that the reason as to why it's called fully structured is that all these questions, the ones you get on the clipboard and the ones you actually get asked in the actual station, are predetermined. They're all preset, which means that everyone who gets interviewed that day, typically speaking, gets the exact same interview experience. So that's a much more standardized way of testing in case that, for a semi-structured interview, you have an interviewer who happened to ask a question they happen to be really, really good at, that happened to allow you to score really, really well, whereas someone else didn't get the same question, and that could have made a big difference in the ability of the interviewee to score. Everything is very consistent. It's to minimize errors in that regard. So like I said, the questions are not usually personal, however they can, and I've heard of interviews that have used more personal style questions and follow-up questions. So when you go into the actual station, they may ask you 5 questions about the scenario that you've read. So it could be up to 4 or 5 questions, of which the first few are usually directly about the scenario, and possibly whether personal questions slide in will be in the latter 1 or 2. So again, it's a very, very structured way of assessing. And at the end of the day, each station will be looking at maybe around, I would say, 5 to 8 traits. And they are separated into what we call primary and secondary traits. Primary traits are shared across and reassessed across the 8 stations. Right, that's the idea anyway. It means that you have 8 different interviewers looking for the same 5 things. And it means that when they submit their marking scheme to the selection committee, they will have 8 sample sizes of how they feel about, let's say, your communication skills. If communication skills for this medical school or dental school is one of the primary traits they're after. So primary traits are really, really, really important, and therefore they want additional opinions from multiple interviewers. And if you did really well on one of them, versus not so well on one of them, they will equal each other out. And on top of that, there are also, in some medical school and dental school interviews, secondary traits. So 5 might be primary traits, and then you get additional 3 that are secondary traits. So secondary traits are still very, very important, but not as crucial to the selection process as the primary traits. So instead of having all 8 stations cross-examining the same 5 primary traits, you might only have 1 or 2 or 3 at a time. So it's still repeated sampling, or in cases they may not be, but it's just important to a lesser extent. Should you care about what are primary traits and secondary traits? Not really. I just think everything's really important, and that's how you score. So when we look at these formats, it's really about the differences in how the interview is conducted. And I've specifically emphasized is not really about the specific types of questions you're asked, right? Yes, there's a preference for one type of question, certain types of questions over others, but it is not exclusive to each format. One thing I really want to talk about with this particular table is that despite a lot of the technical differences due to formatting, at the very end of the day, you're still asked questions and you still have to respond to the questions in order to demonstrate your suitability for the particular school and the particular career that you're after. So a lot of people tell me they say, hey, there's a very, very particular way to prepare for semi-structured interviews, and there's a even more unique way to prepare for MMIs, and they're completely, completely, completely different. I personally think that is completely not the case, because when you think about it, you're always presented with these opportunities to express yourself. And even, as I mentioned before, even though, okay, there is a predisposition or there's a preference to asking particular types of questions more so than other types, depending on the format you're looking at, there is still opportunities for the interviewers to ask, I guess, the atypical types of questions. So for semi-structured, asking more of the ethical scenario-based, and for MMIs, asking more of the personal-based type questions. Universities nowadays are just mixing things up. And I don't think anyone is really following the strict semi-structured or strict MMI format. For example, in Adelaide University, it seems like what they're doing is that they have a 30-minute interview but broken into two stations, and they start off with a scenario-based question and they follow it with more of a semi-structured approach with a lot of personal style questions. So it's all very mixed, and every uni has made a decision to pick their format and attach to it questions that they feel would allow them to find their most suitable candidates. So really, you don't need to worry too much, okay, about the format in making it a completely different, I guess, process for you to prepare. But at the end of the day, it's understanding this is what medical schools and dental schools are doing nowadays, and you got to be conscious of when you walk through the doors what you expect, and therefore you can do your very best.